I did 3 reports on smoking and health. I did a report on smoking as it relates to minorities and other ethnic groups. I did a report on women and smoking, the first report on women and smoking since 1980, and among other things showed that since 1987, more women have died from lung cancer in this country than from breast cancer. In fact, in the year 2000, 27,000 more women died from lung cancer than breast cancer. And that's only one, lung cancer is only one of the effects of smoking on women. It also impacts reproductive health. So we did a report covering that, and then we did a report on reducing tobacco use, in which we really critically looked at strategies like education intervention in elementary and middle school to prevent children from initiating smoking, encouraging physicians to work with their patients in terms of smoking cessation and things like that. But the interesting thing I wanted to remind you when it comes to public health science and politics, despite the Surgeon General's report in 1964, and that there have now been more than 30 reports from the Surgeon General on smoking and health, more than on any other topic. David Kessler, when he was commissioner of the Food and Drug Administration, introduced the concept of smoking as a pediatric disease. And his point was that over 80% of the people in this country who smoke actually began to smoke before they were old enough to legally purchase tobacco, before they were 18 years of age. But because of the addictive nature of tobacco, they then became lifetime smokers in many cases. So he called it a pediatric disease, and based on that, he implemented regulations of selling of tobacco and advertising tobacco to children. But as you know, the Supreme Court later decided that the Food and Drug Administration, in fact, did not have the authority from Congress to regulate tobacco as a drug. So it went back to Congress. And until this day, Congress has not acted on giving the FDA the authority to regulate nicotine, which is one of the most addictive drugs known to man. Because the politics of tobacco in Washington is difficult. I guess in Ohio it is too. But there's a lot of politics around tobacco, and sometimes politics overrides public health science. And that's one example. I released a report in December of 2001 called The Surgeon General's Call to Action to Prevent and Reduce Overweight and Obesity. And any of these reports you can access on the Surgeon General's website or now through the National Library of Medicine. But in summary, that report said that we basically have an epidemic of overweight and obesity in this country, that over 60% of the American people are now overweight or obese, and that overweight and obesity have doubled in children since 1980 and actually tripled in adolescents. So the purpose of the report was to say that we have an epidemic here that is now responsible for 300,000 deaths a year in this country. And if the present trend continued, we said, smoking would overtake tobacco as a leading preventable cause of death. Tobacco now kills about 430,000 people in this country every year, but we were warning that there's been a dramatic decline in smoking since 1964, from about 43% of the American people now down to about 22%. That's still almost 50 million people. But because of the way that that's going and the increase in overweight and obesity, we were warning that we needed to do something about the problem of overweight and obesity, especially in children, And we tried to point out that this was not about appearances, cosmetics. It's about health. There are beautiful people who are overweight and obese. There are beautiful people who are thin. Our point was that overweight and obesity increases the risk of diabetes, increases the risk of cardiovascular disease, increases the risk of cancer of the colon, of the prostate, of the breast, of the endometrium, and of course it increases the risk for respiratory disease. So we tried to make it very clear that this was a public health issue that we were talking about because we didn't want to contribute to stigma. But we also tried to point out that it was not a hopeless situation. And so we talked about what could be done in the home, what could be done in the schools, what could be done in physicians' offices, what could be done in the work sites, and what could be done by the media.